New Mexico, if you get a full, restful, and deep 8 hours of sleep a day, raise your hands. That's just what I thought. Not many of us do. Sleep is the most important thing for us next to eating and breathing. The good people at Koala Center for Sleep Disorders can help you get that sweet sleep that you cherish so much. Here with me today is Dr. Eric Coontz. He's going to talk about how you can do just that. Dr. Coontz, thanks for being with us.
Thank you, Khalil. It's great to be here.
Wonderful. So question, how did you become interested in treating obstructive sleep apnea?
Well, I've struggled for more than 15 years with obstructive sleep apnea. And I've had CPAP machines, wore masks, all kinds of things. And it really hit home when I had a heart attack 2 years ago. About 4 o'clock in the morning, started to have chest pain, and was rushed to the hospital and was taken care of, thank God. But because it happened at 4 o'clock in the morning, it is suggested that sleep apnea had a lot to do with it.
That's something else.
So I thought that I would do as much research as I could and see how I, as a dentist, can help patients.
Now, how can dentists help people with sleep apnea?
Well, the whole point of sleep apnea treatment is to open a patient's airway. And with conventional methods, the gold standards such as CPAP, the CPAP machine allows air at a very high pressure to open up your airway. Some people can't tolerate that. So we have oral appliances which can open the airway by protruding the lower jaw very gently, putting it in a proper position so that it's comfortable for the patient, and it opens the airway up. And air can then get into the lungs for the patient.
Maybe you can sleep and breathe deeply.
Correct.
That's wonderful. Now,
Yes.
at the Koala Center, what can patients expect when they come in for an appointment?
Well, we do an oral exam, of course. We also administer what's called an Epworth exam or screen, and that is a test that the patient actually takes. And it determines how sleepy they are during the day. If they pull up to a traffic light, or do they start to fall asleep? Do they sleep while driving? We do an oral exam. We look at the position of the tongue. We look at the structures of the throat. And then if we deem that an appliance is the best way to go, we'll take molds of the upper and lower teeth, and we send that to a lab, and we have an appliance made. And I brought several different appliances that we have.
I see these. Now, how does a patient know, how do you know that their oral appliance device is working?
What we do is we have a patient have a sleep test. The sleep test gives us a lot of information. I don't diagnose the sleep problem. I treat the sleep problem. It's the physician that diagnoses the sleep problem. So if a patient goes to a sleep lab, it's a sleep physician that actually reads the test and does the diagnosing. Patients can have a home sleep test, and we can administer that test, but it's still a sleep physician or a pulmonologist who reads it and lets us know. So we can look at the various parameters to see if they're getting better, and that tells us if our appliance is working.
This is a wonderful thing that you're providing. I'm going to send
Thank
a
you.
former housemate to you because we nickname her the conductor of the Snorkestra. Oh yeah, she woke us up big time.
Yeah.
Dr. Coontz, thank you so much for being with me today.
Khalil, pleasure. Thank
Wonderful. Absolutely wonderful. To find out more about the Koala Center for Sleep Disorders, go to www.abqsleep.com.